Since the 17th century, nurses have been a mainstay for those in need of care. Times have certainly changed since then. Technologies and practices have advanced. As they continue to progress, so does the standard for nursing excellence. But the current nursing shortage has many medical scholars concerned about the quality of education and training for today's nurses.
The challenge in preparing nurses is not only filling numbers, but it really is figuring out how to put the best prepared person to be able to develop the best patient care. And this is an issue because of the knowledge revolution, because of the use of new technologies, that we need to prepare a different skill set for nurses to be able to deal with these challenges in the workforce.
Beyond the bedside, nurses play an important role in all areas of healthcare.
We have nurses walking the halls of Congress. We have nurses who are CEOs of healthcare systems. We have nurses who are presidents of universities. So there's never been a better time to use the skills and training that nurses have to solve not only the healthcare problems of patients and families, but throughout the continuum of care and beyond, into policy, into management, into leadership throughout our system. And what we're increasingly realizing is that our nurses need critical thinking skills, that they need to understand the way to communicate with a multitude of providers, patient families, etc.
In response to this need, some higher education institutions are raising the bar on their curriculum. At the University of Michigan School of Nursing, students are being taught how to be leaders in their field through exposure to everything from advanced technologies to interdisciplinary collaborations.
That is really the focus of our leadership preparation, is helping our students understand that, so they're not focusing just on individual patients, but also the care unit and what's happening. They're understanding the various disciplines and how that interacts with the needs of patients. And they're understanding how they need to prepare patients to go home and care for themselves.
One of the key elements in preparing future nurses involves the outcomes of evidence-based practice.
Evidence-based practice is the use of the best available research, the best available knowledge that we have, and applying that to patients. Why it's so important is because it takes the guesswork out of what it is we do. We're a science discipline, and we need to be applying science and those findings to patients at the bedside. More importantly than providing nurses with the skills to use evidence-based practice is preparing leaders to be able to champion the use of that knowledge, to make whatever changes are necessary at the bedside or in whatever systems people are working in.
And so they benefit from participating in the research itself, learning how to be researchers, watching us develop the science, implement the studies, and it's a total experience.
You learn how to use the core values and take the evidence-based practice and in turn use them in your nursing practice in the future. So I've learned myself and how to become a good leader in nursing for the future.
By educating and training students like Leslie at such an advanced level, educators at the University of Michigan School of Nursing hope to eliminate stereotypes that have plagued the profession for many years.
I'm confident that the program that we're developing here and further developing as we go will exactly do that, to break through the barriers and to help nursing become a discussion partner, to have nursing become more of a leader in our healthcare arenas, so we can provide this high-level quality of care using optimum amount of resources, being efficient and very effective, and to establish the better health care outcomes for our patients and our families.
About 2 years ago, we joined with the University of Michigan Health System, which itself is also one of the top institutions in the country. And we believe that by merging the two organizations of the school and the health system, we can come up with a better way of not only educating our students, but also practicing in the healthcare system. We call this partnership the Initiative for Excellence in Nursing Education, Practice, and Research. In this environment, we're bringing our students in who will be mentored by the staff nurses and become part of the team caring for patients.
I'm going to do a quick assessment right now. Okay, so Leslie, why don't you go and do that?
Thank you.
So no longer are our students coming in as guests on a unit, with a faculty member who's a guest on the unit. They are both now critically integrated into the team system in the University of Michigan Health System. And through that process, they are not only learning, but they're participating in the care development and in the policy development that will affect quality of care.
By better preparing today's nursing students, educators at the University of Michigan School of Nursing are optimistic that more men and women will want to be a part of this dynamic profession, resulting in an increase of nursing leaders for generations to come.
Student enrolling here at Michigan can expect to be challenged. They can expect to be involved in a very exciting environment of the very best across this campus. We are privileged to be on a campus where every school is highly ranked, where the faculty are the best in the country. The students, their peers, are among the best in the country.
The most exciting thing for me actually is making a difference in the lives of the clients that I will and the patients that I will come in contact with every day, because that's why I went into nursing. That's why I chose one of the best programs, because I want to make a difference in individual lives of people so that it can be exponentially felt throughout my community and the global community.
For more information on the University of Michigan School of Nursing, log on to nursing.umich.edu or call the number on your screen.